Summer Health Professions Education Program, also known as SHPEP, is
a free summer enrichment program for college students
to explore their career of interest in the field of healthcare. This year, we also have the Minority Serving Institution Pathway Initiative, which is an AAMC-funded initiative integrated into SHPEP.
MSIPI will exclusively focus on medicine, offering a unique opportunity to further exposure of incorporating the rich cultural values, traditions, and heritage of American Indians, Alaskan Natives, and African American communities.
Both programs will offer opportunities like clinical exposure, academic enrichment, career development, and financial literacy,
allowing students to develop competencies for becoming successful applicants to health professional programs.
To learn more about the eligibility criteria and how to apply, please visit SHPEP.org.
The application deadline is Wednesday, February 5th at 11:59 Eastern Standard Time.
Please don't hesitate to reach out to us with any questions you might have.
The talent show that my cohort and I did, and it was just a really fun time to get to know each other and kind of like showcase some of the talents that we all had. In my group, we did we danced to Afro beats, and so that was really fun, and we actually placed second, so that was a fun time.
Student-patient encounters. With the student-patient encounters, we had simulated physician-patient interactions with actors who were either really depressed or really angry or had other strong emotions, and this helped us learn how to establish rapport with different types of people.
When we all went on that great hiking trip where I got to interact with students from different programs such as PT, optometry, dentistry, and I got to grow my connections and make new friends.
Visiting the cadaver lab.
Whenever we were able to go to the UT Health Houston School of Dentistry and shout out the D3 and the D4 students. It was so cool and I loved it so much.
Being clinically exposed to what a 12-hour shift would look like being a nurse.
Exposed to different sides of healthcare, whether through medicine, dentistry, optometry, physical therapy, whereas through shadowing experiences, taking a bunch of classes in organic chemistry, biochemistry, statistics, or whereas to doing stimulational lab sessions or case scenario questions. So far, this program helped me solidify my choice to want to pursue a career in medicine and hopefully aim the PhD become a surgeon scientist in the future.
It allowed me to step out of my comfort zone and use all the available resources around me. And it also showed me the importance of collaborating and working with peers around you. So like, for example, there's different tracks in the SHPEP program, but at the end of the day, it showed me how important it is for all of those tracks to work together since we all have the same goal, and that is to deliver quality patient care.
Face my insecurities behind becoming a physician, as well as learn to utilize them in ways which I can positively impact the lives of fellow students interested in pursuing a career in healthcare and eventually patients in a medical setting.
To learn from other similar-minded pre-health students from around the country, allowing me to see which steps I should be taking to further my career.
Providing me with research opportunities and shadowing opportunities, which we all know are huge parts of the medical school application. And one of the positions I actually shadowed was an OB-GYN, and she has been so helpful and kind to me, writing letters of recommendation for me, which wouldn't have been possible through SHPEP. So I was able to gain a really cool mentor and a really close friend that I can talk to whenever I need help or guidance.
I feel like I became a more well-rounded applicant through SHPEP. I lacked a lot of confidence, and I got to gain some of that back by speaking to a lot of the dental students that went to the University of Iowa, and they were able to pass me some of their wisdom and advice for when I applied to dental school. And we also got to have lunch with the admissions directors that will be reading our applications and that we would have interviews with. So I was able to hear their insight, hear their constructive feedback, and work on my interviewing skills, which I feel like will help me be successful when I apply to dental school.
Allowing me to explore different tracks such as dental, pharmacy, and public health, ultimately confirming my passion for medicine. I also was able to learn about different opportunities I could use in the future, and also how I can get involved with research.
Always make sure to mention your passion, as it is one of your greatest strengths. Something else that is equally as important is to mention unique experiences that you have been through.
To really prioritize standing out as a student, I would also recommend looking into different topics concerning your intended medical pathway so that you can write about them in your essay, but also so that you're more knowledgeable on those topics.
This is said so many times, but it really is to find something unique and highlight that. And the reason why it's said so many times is because it is so important. You'll be going up against, hundreds, maybe thousands of applicants. So what can make you stand out? That's going to be your unique personality. And remember, it's not only what you say, but how you say it. How can you turn your quirks, personality into a unique story that's going to make you stand out from other applicants? Once you figure that out, you'll be set.
Don't be hesitant to ask questions. We are here to support you.